Hi, I'm Dr. Karen Tang. I'm a board-certified gynecologist and the author of It's Not Hysteria, Everything You Need to Know About Your Reproductive Health, But We're Never Told. And welcome to The Doctor is In with FlowSpace. If your doctor has told you that you have a weak pelvic floor, there's a few things that you can do. First, there's a whole specialty of physical therapy called pelvic physical therapy, or pelvic PT. These are specialists who are dedicated to knowing how to treat the pelvic floor. So very often, your gynecologist or your primary care doctor may be sending you to a pelvic physical therapist to train and guide you. At home, you can do a few easy exercises to at least get started on strengthening your pelvic floor. So unlike some other exercises, I can't show you on myself where the muscles are. So you have to use a little bit of visualization. So to imagine your pelvic floor, there's a couple of different things to do. So pretend like you're urinating and you have to cut off the stream of urine. Or pretend like you're trying to pass gas, but you want to hold it in. So you're doing both a contraction and you're also lifting your pelvic floor when you squeeze those muscles. So if you visualize to yourself the muscles that you would use to stop the stream of urine, to keep a fart from coming out, those are your pelvic floor muscles. Very important when you are trying to strengthen them that you don't squeeze other things. Because a lot of people, when they hear Kegel exercises, they just tense everything. They tense their butt cheeks, their legs, their core. You actually want to purposely keep those relaxed because you want to keep the contraction in your pelvic floor. Also very important is that you also are not just squeezing, you're also relaxing. So just like when you are exercising your biceps, you're not just going like this. You're doing the whole range of motion where you're relaxing the muscle and then contracting it. So when you picture your pelvic floor, think to yourself your breathing pattern. This will help you also isolate it. When you inhale and your diaphragm goes down, your pelvic floor also relaxes. When you are exhaling and your diaphragm goes up, your pelvic floor is lifting. So you have to also pair not just the squeezing of your pelvic muscles, but also your breathing motions, because that actually is a natural part of how your pelvic floor works. Breathing in, letting your diaphragm drop, relax your pelvic floor. When you are breathing out, diaphragm goes up, lift your pelvic floor. When you do these exercises, we tell people you're going to try and contract your pelvic floor muscles for a count of 10, if you can. Do it with the exhale. Hold it there for 10 seconds. And then relax it for 10 seconds. The relaxation is just as important as the contraction. And if you can do that 10 times in a row, hold for 10 seconds, relax for 10 seconds, do 10 reps, and you try to do that a few times a day. And you can also mix it up with shorter reps because, doing a shorter motion is also important. So contract for 1 second, relax for 1 second, and then repeat. And if you can, do 2 to 3 reps of those throughout the day. Another trick to try and imagine where your pelvic floor muscles are pretend like you're trying to pick something up with your pelvic floor muscles or with your vagina. So pretend there's a blueberry sitting just outside your vagina. You're trying to lift it up. So you're not just contracting your muscles, you're lifting too. So contract and lift. And to tell that you're squeezing the right muscles, you can actually also take a clean finger, insert it in the vagina, and you should feel the muscles contract around your finger and also lift a little bit.